Hello everyone, my name is Dr. KaiYan Li. Today is my honor to be invited by the World Traditional Medicine Forum and WHO to do my presentation about a case study of long COVID syndromes treated by traditional Chinese medicine. During this presentation, I'm going to cover all the contents shown below. First is the long COVID syndrome background, and secondly, I will introduce a case study, including all the timeline, signs and symptoms, treatments, and my reflections. First, let's look at the long COVID syndrome background. Long COVID syndrome is a relatively new disease where essentially patients experience lingering COVID symptoms even when COVID tests show negative results. These symptoms often include fatigue, body ache, shortness of breath, concentration difficulty, inability to exercise, headache, sleeping issues, and more. According to studies conducted in both Australia and the United States, around 40 to 80% of COVID patients experience these lingering symptoms months after initial onset of infection, despite no signs of virus could be detected in tests. This means long COVID syndrome is common in COVID-19 patients, and modern medicine has yet any cure method. Traditional Chinese medicine has a record history of more than 2,000 years experience with treating over 300 different epidemics with success. I have been using traditional Chinese medicine to treat a couple of long COVID symptom patients, and they all have significant improvements. This is why today I'm going to present this case study to give you more insight on how to treat long COVID syndromes from traditional Chinese medicine perspective. So let's come to the case study. Sarah is one of my long COVID symptom patients. She is a 34-year-old nurse working in a nursing home where she obtained the COVID-19. This photo was taken from the ICU where she was sent to by ambulance due to the first onset of shortness of breath. I captured this photo from her interview with the ABC News about her long COVID syndromes. She was diagnosed with coronary pneumonia in July 2020 and treated with antibiotics and steroids, but her shortness of breath still not improved. CT scans show pulmonary thrombosis and fibrosis, which means blood clots and fibrillation happens in her lung. She was given blood thinning medication since, but nothing seems to work. 2 months later, she returned to the hospital for a GI bypass surgery targeted towards her weight loss. However, her results was less optimistic than expected. Up until February 2021, before she came to see me, she has been in and out the hospital more than 10 times due to the shortness of breath. Clinical symptoms. The first time when she come to see me, the main complaint is the hoarse voice and shortness of breath. She is unable to lie flat during the treatment, and she feels a lot of sticky phlegms in her throat that's hard to cough out, and also she experienced chronic fatigue. At the meantime, she has a lot of body aches and heaviness sensation, and especially she feels a lot of lower back pain. Also, she has night sweats, thirsty sensation, a strong anxiety sensation, and depressed. Also, her emotion feels a lot of fearful minds, and also the insomnia and foggy heads happen. On observation, I noticed that her tongue is red with no coating, and her pulse, the left one was deep, thin, and rapid. The left one was wiry and rapid. The right one was deep and weak, and the right one was slippery. Both of the chin position was deep and weak. According to the signs and symptoms and my observation, I make her diagnosis as shown below. It involves 3 parts. The first one is the lung qi and yin division, causing lingering pathogens and night sweats. Also, she has the residual wind and phlegm blocking in her airway and causing hoarseness and shortness of breath, and also foggy mind. Second part is the liver qi stagnation and transform into heart fire, causing depression and anxiety emotion. And number 3 is the heart and kidney disharmony. The patient suffered from strong heart fire in the upper jaw, but weakness in the kidney, which caused the discommunication of a heart and kidney and insomnia. Also, the fearful sensation belongs to the kidney division, and the lower back pain is also another evidence of the kidney division. According to the diagnosis, I make my treatment principle as below. I tonify the qi and yin, expel wind cold, resolve phlegm and dampness, soothe the liver qi, and clear heart fire. Also, I strengthen the kidney and calm shen. Treatments. My treatments involve 3 parts. First, I use the gua sha and cupping on her neck and back. For the gua sha part, I focus on the whole neck, involve 6 channels as shown as below. So du channel, bladder channel, gallbladder channel, sanjiao, large intestine, and small intestine. Later, I will have a photo to show the results. So, and you can see a lot of marks coming out from the channel, and the patient can feel instant relief from the hoarsened voice. Also, the back gua sha, I focus on the du channel and bladder channel to expel the wind and cold. And following the gua sha, I do cupping on the du channel, and also I do stable cupping on the ding chuan, bladder 13, 23, lung 1, range 17 to 22. So I involve the cupping on both the front and the back to expel the wind cold or draw the coldness from the lung. And also I resolve the phlegm and clear some heat as well. And following the cupping and gua sha, I do acupuncture. First, I use the large intestine 4 and liver 3 to open 4 gates to soothe the liver. Heart 6 and pericardium 6 to calm shen and stop night sweat. Gallbladder 20 to expel wind. Lung 1, 5, 7 and range 17 to 22 to descend the lung qi, recover the lungs D&D function. And also I use the spleen 6, stomach 36, kidney 3 to strengthen the spleen, stomach, and kidney. Also nourish both the qi and yin. So the third part, I use the herbal medicine to give the patient to take it at home. My treatment plan is to have a weekly visit for the first 4 weeks. So I use the guizhi to expel the wind cold. 杏仁、苏子、葶苈子、贝母、至半夏 and 海蛤壳 to resolve the phlegm, stop wheezing, and clear dampness. I also use the houpo to descend the lung qi. 麦门冬 and 五味子 is the 生脉饮 to nourish both the qi and yin. And also I use the taoren to remove some blood stasis from the lung channel. On her second visit, both the hoarseness and the chest tightness was significantly improved. She felt better sleep, and also she lost 3 kilos in 1 week. The lower limb swollen has been reduced. I then repeat the same treatment and the formula, plus 血府足语丸, 15 pills and twice a day to further resolve the qi and blood stagnation in her upper jaw. On the third visit, the feeling of anxiety and fear increased because someone broke in her house that week. She couldn't fall asleep at night again. Therefore, my acupuncture mainly focused on the calming the shen. In addition to the above acupoints, I use the Spring 4, Pericardium 6 to open the Chong Mai to calm her Shen. Also, I use the 220 and Hot 7 to calm Shen and help with her sleep. 1 week later, on the 4th visit, both her anxiety and depression were a lot better. Energy increased, and she mentioned she could walk 4 to 5 kilometers continuously without feeling wheezy. And she just feel a little bit fatigued after this walk. Occasionally, she feel wheezy at nighttime, but most of the night she can sleep through. Sarah was so happy about her improvement, and thus she mentioned during her interview with the ABC News that Chinese medicine has helped her a lot during recovery. Unfortunately, so this part of the statements didn't broadcast when the ABC News broadcast about this documentary. But yeah, so she did mention that during the interview. These photos were taken from our consultations, and the patient felt instant relief on the throat, and she can speak with a lot clearer voice just after 10 minutes gua sha on her neck. You can notice that a lot of marks on both of the side and the back of the neck, and in the bladder channel, gallbladder channel, and small intestine, large intestine channel. Also, the tightness of the chest and shortness of breath feel much better straight after just one treatment. Reflections of my treatments. First, the pathogenesis of long COVID syndrome is complicated. It involves the zheng qi deficient with some lingering pathogens. Even though the patient's main complaint is the hoarseness of the voice and shortness of breath, it sounds like just only the lung disease, but actually 5 organs have involved. So this has been convinced by the Yellow Emperor's internal medicine statement. So in the cough chapter, there is a statement mentioned about 5 organs can cause cough, not only lung. So I do a chart in here to show you more directly so how it works for the COVID-19 long COVID syndromes. So the pathogens, the COVID virus, or maybe the wind, cold, dampness, toxicity. So they get through the mouth and the nose and through the airway, attacking to the lung system. So the lung could not dispersing and descending. So that's why the patient have coughing, wheezy, shortness of breath, and even the hoarsened voice. So the lung in charge of qi and the heart in charge of the blood. So when qi is stagnant, the heart will stop too. So that's why the patient suffering from some blood clots in the lung. So this is the relationship between qi and blood stagnation. And also the mental stress from knowing herself diagnosed with coronary pneumonia and the fear of being isolated from her family as well as death will cause a lot of liver qi stagnation and kidney weakness because the kidney in charge of the fear emotion. When the liver qi stagnant, it will have 2 results. One is the wood overacting to the earth, which is the spleen and stomach system, and causing the spleen and stomach weakness and the dampness and phlegm generated. So, and they will send to the lung system and give the feedback like this. And also the liver is the wood. It can generate some fire and invading to the heart and causing some panic attack, anxiety, and depression emotion. And also the kidney is weakened. Kidney in charge of the lower back. So that's why the patient have a lot of joint issue and also lower back pain. In general, the kidney in charge of housing the spirit. But when the kidney is weak and hot fire is strong in the upper jaw, so they discommunicate with each other and causing the insomnia and fear emotion. Since the 5 organs have involved in the long COVID syndromes, thus the treatment shouldn't only focus on the lung system. Instead, we use a holistic approach, or what we call the cocktail treatment, to achieve the optimistic results. Second part of my reflection is the psycho-emotional factors plays an important role in long COVID syndromes. This can explain by the relationship of the 5 elements. In general, metal controls the wood, but when the wood is too strong, it can insulting to the metal and weaken the metal energy. So this is what happens in the long COVID syndromes. So the emotional affecting to the lung immune system. And also there is a statement in the Yellow Emperor's Internal Medicine mentioned about when the heart shakes, the 5 organs and 6 food would be shaken too. This means the heart plays an important role in the 5 organs balance. If the heart spirit is not settled, the 5 organs will be out of place. That's why calming Shen and building up the patient's confidence to overcome the disease are essential in the treatment of long COVID syndromes. The third part of my reflection is about the treatments. So the treatment strategies in the long COVID symptom in this case study, they are opposite yet synergistic. For example, I use the tonifying and clearing together. I tonify the Qi and Yin. I use the tonify method to target to the lung, spleen, and kidney. But also I clear the residual wind, cold, and phlegm, blood stasis, liver qi stagnation, heart fire, and all the excess pathogens. Also, I use the warming and cooling. I warm the lung, spleen, and kidney, but cool the heart fire. I use both expelling and extringing. So I expel the wind, cold, dampness, the external pathogen, but I astring the zheng qi, so qi and yin, and stop the noise spreading from further damage to the qi and yin. I use both the drying and moisturizing methods. So I dry the dampness and phlegm, but I moist the lung and kidney. I combine the descending and ascending methods. So ascending the zheng qi, but descending the lung qi. I also use the qi and blood balancing and move the qi as well as the blood. So this is the treatment strategies. And also my treatment methods is a lot of variety and mixed approach. I use the gua sha methods to expel the external pathogen. I use the cupping and acupuncture to deal with the more internal pathogens and rebalance the 5 organs. Also, I use the herbal medicine to ongoing helping the patients when she's like having no treatments for the whole week. And it's deeper to cleansing the pathogens and rebuilding the energy. And also I use the TDP heat lamp to heat up the local lung, back pon and front pon to expel the wind cold and also activate the zheng qi. In conclusion, Chinese medicine has its unique advantage in treating long COVID syndromes. Therefore, should be involved in the treatment of COVID-19, especially during the recovering stage. So these are all the references I quoted for my research. Thank you all for your time, and I hope this has given you insight on TCM diagnosis and treatment for long COVID syndromes. Keep safe and healthy during this ongoing battle of COVID-19.